right. Hi, Samantha. So I see you came in today with some questions about twins and how I identify twin pregnancies and how we handle them in the practice. Um, and also just some general questions about twin pregnancies. So I'd love to answer those for you today. Um, First off, I would like to say how I identify twin pregnancies is that every appointment beyond 20 weeks is we are measuring your fundal height, so we're measuring the growth of the baby. And typically the fundal height will coincide with your gestational age. So when we have a fundal height that's very large, that typically means that something is going on with the baby. So that can be an indication that there are twins. And in that case, we would send you for a growth ultrasound to determine how big the baby is and to rule out if you are pregnant with twins. So because twins run in your family, that's something that we'll be monitoring and looking for. I also, in this practice, I strongly recommend a anatomy scan at 20 weeks. So that is when they go and they check out every piece of the baby and make sure everything is developing really normal. And at that pregnancy, if you are pregnant with twins, that would be a time that they would check for that. So those are like two different ways that we ensure that there won't be a surprise twin home birth in our practice, just to make sure that we are kind of staying ahead of the game. Additional kind of questions that you have are just in general, like different types of twin pregnancies. So I want to go over that with you a little bit. There are a variety of different types of twin pregnancies. So you often hear, the two that you often hear for the general population is, are my twins identical or are they fraternal? But for us, there's many more questions that we have. The biggest question is if the babies share a placenta. When babies share a placenta, there's additional risk factors when they do share that. So that is something that we want to check to see if they're sharing a placenta or if they each have their own. If they each have their own placenta, this is called dichorionic pregnancy. So that means that each baby has their own umbilical cord, and that umbilical cord attaches to separate placentas. In a monochorionic pregnancy, the placentas are all one. So the babies each have their umbilical cord and they both go to the same placenta. Another thing that we're evaluating is if they're diamniotic or if they're monoamniotic. So if they're monoamniotic, that means that they share one sac. If they're diamniotic, that means that they each baby has like their own little sac. So you will hear things like di or di mono or mono. In the home birth community, most midwives that do twin home births, they want to make sure that the pregnancy is a di. So you want to make sure that each baby has its own placenta and sac and that they are separate. Mono pregnancies they're like the largest risk for a twin pregnancy, where they share the same amniotic sac and they share the same placenta. So those are like the different types of twin pregnancies, and that is pretty much the number one question when we find out that you are pregnant with twins. We want to get you in for an ultrasound right away with maternal fetal medicine to make sure that it's a level 2 ultrasound and that they're really able to see all the different things, all the different parts. The earlier the ultrasound, the easier it is for them to determine if they're sharing a placenta and a sac or if they're not. So like I kind of was talking about before, there's additional risk factors that come with being pregnant with twins. And the risk factors do coincide with what type of pregnancy it is. Obviously with any type of pregnancy, even the lowest risk, the di, there are still risk factors because you are carrying two babies and you have to sustain two babies and the two babies have to grow properly and all the things. So there are always risk factors with a twin pregnancy, but there can be additional risk factors depending on what type of twin pregnancy you have. So sharing a placenta is one risk factor that can lead to more difficult complications such as twin transfusion syndrome. That occurs when one twin is getting more blood flow than the other, and therefore they're getting more nutrition, they're growing probably at more rapid rate, and then the other twin will have complications such as being anemic or IUGR, which is intrauterine growth restriction, or hypovolemia. So there's additional risk factors for that twin if that occurs. And then there's other things like if they are a monoamniotic type of twin, so that, remember, that's them sharing the same sac, that they carry other risk factors such as entanglement syndrome, the cords knotting, or even strangulation from the cords, because now you're all in one bubble and there's placenta and there's cord everywhere and babies flip and move and turn. So there's risk factors with them getting tangled in the cord and that becoming a greater risk factor. Another risk factor for twin pregnancies can be what's called a twin, I always have to read this because I always forget all the things, but a twin reverse arterial perfusion sequence. And that is when there's a twin pregnancy, but one of the twins does not develop properly. So they're often born without a heart. They're born without a head. It's kind of just like a mass. Sometimes they don't have arms and legs. And what happens is there's almost a cord coming out of your normal baby, which is called a pump baby. And then that cord is going in to sustain blood flow to that other twin. That won't be able to survive outside the womb. And what happens is the pump twin, so the normal twin that developed properly, can have complications such as like premature birth. They can be anemic. They can have heart failure because they're not getting enough of what they need because they're just pumping it to the other twin mass. So there's procedures that can be performed in order to stop that blood flow. But that is an additional risk factor for twins. And then, of course, we have conjoined twins and other complications such as like locked-in syndromes when the twins become kind of locked and they can't be born vaginally, and placenta abruption. Those are more complications that come later to delivery. If you are, like I said before, if you're a die pregnancy, that is the greatest chance that you have for having a vaginal delivery. As you move closer to a mono pregnancy, the recommendation is a C-section, just because if one twin is born and the placenta starts to come off, then the other twin can actually pass away because of how much they're sharing. It's important that they be born via cesarean and that they both can come out fairly quickly so that there's no complications as far as them being deprived of oxygen. So my practice does not do twin deliveries. That is not something I am comfortable with. There are too many risk factors for me to be comfortable with delivering twins at home. Even in a die circumstance, I've been a part of a couple of twin pregnancies where one baby comes out and then there's a lot of bleeding and we're not sure where the bleeding is coming from, and we want to make sure that baby B is still okay. So for me, it's safest if I feel most comfortable if I transfer out of care. And when I do that, I make sure that you are provided with a list of other home birth practices that do perform twin pregnancies. So that is information that you will have. I also provide a hospital list of providers that are really great and nurturing and understand that your plan was a home birth and can kind of scoop you up in the hospital setting and just provide really great care. So that is what I do as far as management plan and making sure you're okay. I also will refer you to maternal fetal medicine to make sure that you get the care that you need and we understand what type of pregnancy this is. As far as management, like I said, I will check fundal height. I will make sure you're staying within that range of normal. And if we see anything outside of that, then I would get you a growth ultrasound. And then we also do the 20-week ultrasound to rule out any type of twin pregnancies. As far as nutrition recommendations, support, other testing, there's varying degrees of research that say you should eat more in pregnancy because you're twins. But Real Food in Pregnancy does suggest eating increased amount of protein. And then lastly, here in Connecticut, we are not regulated by anyone or anything or any law or any guidelines, which is good and bad, depending on how you look at it. But because of that, CPMs are not mandated to transfer all multiple pregnancies.